Dengue fever is an illness you can get from the bite of a mosquito, carrying one of 4 types of dengue virus. The virus is most commonly found in tropical and subtropical regions, including Central and South America, Africa, parts of Asia and the Pacific Islands. Dengue isn't contagious from person to person, except when passed from a pregnant person to their child. Symptoms are usually mild with your first infection, but if you get another infection with a different version of dengue virus, your risk of severe complications goes up. Research estimates that nearly 400 million people get infected with dengue each year, but most, about 80%, have no symptoms. Most infections don't cause symptoms. If you do have symptoms, high fever is typical along with rash, intense pain behind your eyes, nausea or vomiting, muscle, bone and joint pain. The symptoms start to appear 4 to 10 days after a mosquito bite and can last 3 to 7 days. About 1 in 20 people sick with dengue will develop severe dengue after their initial symptoms begin to fade. The severe dengue is a life-threatening worsening of dengue symptoms. Warning signs of these are usually seen 24 to 48 hours after your fever goes away. It is a medical emergency that can be fatal. If you have dengue or live in an area where it is common, go to the nearest hospital immediately if you experience any of these symptoms: stomach, abdominal pain, frequent vomiting, throwing up blood or blood in your poop, nosebleeds or bleeding gums, extreme tiredness, restlessness, or irritability. Dengue fever is caused by one of 4 dengue viruses. When a mosquito infected with the virus bites you, the virus can enter your blood and make copies of itself. The virus itself and your immune system's response can make you feel sick. The virus can destroy parts of your blood that form clots and give structure to your blood vessels. This, along with certain chemicals that your immune system creates, can make your blood leak out of your vessels and cause internal bleeding. This leads to the life-threatening symptoms of severe dengue. The virus is spread by Aedes mosquitoes, which also carry viruses like Zika and chikungunya. It is diagnosed with a blood test. Your healthcare provider will take a sample of blood through a vein and send it to a lab to look for signs of dengue virus. This may also identify which of the 4 versions you have. Your provider can use a blood test to look for other viruses that cause similar symptoms. Managing your symptoms is the only way to treat dengue fever. Follow your healthcare provider's recommendations, which may include keeping yourself hydrated by drinking plenty of water and fluids, getting as much rest as possible, treating pain with acetaminophen, like Tylenol. This can increase your risk of life-threatening internal bleeding. The 2 main ways to protect yourself from dengue are through avoiding mosquito bites and vaccination. The best way to reduce your risk of dengue is to protect yourself from mosquito bites. Use insect repellents known to help keep mosquitoes away. Cover exposed skin outdoors, especially at night when mosquitoes are likely around. Remove standing water, buckets or barrels, old tires that may hold rainwater. Keep mosquitoes outside of your home by repairing holes in screens and keeping windows and doors closed if possible. The second way to avoid dengue fever is through Dengvaxia vaccine. But Dengvaxia is recommended only if you've already had dengue before, because getting infected once with dengue makes you more likely to get sicker. If you get another version of the virus, most people recover from dengue fever without any lasting complications. If you have severe dengue and are treated immediately at a hospital or medical facility, you have a greater than 99% chance of recovering.